I'm very concerned about the resurgence we've seen of vaccine-preventable illness, and I think many of us have heard about the outbreak of measles in Southern California, and I know that there are many parents and community members who are concerned now about not just measles, but about other illnesses which may be preventable, but which we may be at risk for because people aren't getting immunized the way they used to. I think that it's very important that people get immunized. There are diseases that we can prevent, like measles, but there are also illnesses like the flu, for which we have vaccines available, and it's important for us to get vaccinated for the flu as well. So my message as I go to communities across the country is to emphasize the importance of vaccination. I understand that there are concerns that communities, like some individuals have about whether there may be harmful effects from vaccines. There's been some concern about whether the measles and mumps and rubella vaccine, for example, causes autism. I want to say that definitively there have been studies which have proven that there is no link between the measles vaccine and autism. But not everyone has gotten this message, and so that's partly why I'm here out on the road to talk about the importance of things like immunization. The way I approach this is I recognize that when people have concerns about vaccinating their children, that comes from a good place. Ultimately, every parent wants to protect their child. They don't want their child to be at risk for being hurt in any way. So I recognize that, and I think it's important for all medical professionals to recognize that. But I also think that we have to share what we know about the best of science and what it says about immunizations. And the truth is that there was a time in this country where we saw far more vaccine-preventable illness before we had the ready availability of vaccines like the MMR vaccine, like the flu vaccine, like others. And folks who remember those times remember that those were not happy times. We had many people that we would lose to deaths, many people who were, for example, in the case of polio, who were paralyzed because of illness. And the availability of vaccines was a real boon to our country and to many folks. We have forgotten a lot of that because of the success of vaccines, ironically. But part of what's going to be important for us over these coming years is to make sure that we are sharing the science of vaccinations with the community so they understand that the MMR vaccine, for example, does not cause autism, and they understand the importance of not only that vaccine, but also the flu vaccine and others as well. The leaders that I met with in Kansas City earlier today shared a number of concerns that they have. First was a concern around mental and behavioral health, around the continued stigma that we have with mental illness, but also the difficulties with accessing mental health care and the lack of integration with traditional medical care. But they also shared concerns about violence in the community. They shared concerns about childhood obesity, about prescription drug abuse, which are increasing and at record levels. And they shared concern about the importance of prevention, but the challenges that we face in getting funding bodies and others to recognize that prevention is worth the money that we spend on it. The most important thing that I'm learning as I travel to communities across the country, including Kansas City, is the importance of community collaborations. The problems that we face, whether it's childhood obesity or prescription drug abuse, these are not problems that one agency or one group of individuals can solve on their own. But there are problems that require multiple organizations and sectors to be involved in. And I'll give you an example. One of the leaders I heard from today was speaking about the challenges with childhood obesity that we're facing here in Kansas City. And she was telling me that we can't just solve those problems with the Department of Public Health alone, trying to get information to parents, but we really need the cooperation and collaboration of schools. And so I was very happy to hear that many of the schools in the school district is collaborating with the Department of Public Health as well as with other agencies and seeing how we can build interventions that will help to reduce our rates of childhood obesity. As you know, when children suffer from childhood obesity, that has an impact on their mental health, but it also has an impact on their school performance. And so it's in everyone's interest to make sure that we are doing what we can to tackle problems like childhood obesity. But the larger issue is that these kind of community collaborations are essential. They're what we need to do to really tackle problems which often have multiple sources. Violence, unfortunately, is an issue that touches many communities, and there are many types of violence, whether it's domestic violence, whether it's gun-related violence, whether it's there are many types of violence, unfortunately, that communities are impacted by. And I heard many times today about how violence is a problem that community leaders here perceive to be urgent and important. And it impacts health, because it causes injury that's both physical, but also it creates scars that can't be seen, that result in post-traumatic stress disorder, that result in other behavioral and mental illnesses. And so, violence is a real problem that healthcare providers see every day. And I will tell you that, as a physician who is taking care of thousands of patients, I've seen myself firsthand, how violence can tear apart not just individuals physically and mentally, but also really impact families. So I heard very clearly from the leaders here in Kansas City that violence is something that they feel needs to be addressed and addressed urgently. What I would say, first of all, is number one, it is important to get vaccinated, whether it's for measles with the MMR vaccine or whether it's for flu. Now, there have been some concerns out there and some storylines that the vaccine this year for flu is not as effective as in prior years. And it's true that the vaccine is not as effective as we want it to be, but it still does work for some people. And it's important for everyone to get vaccinated, because even if it reduces your risk by 25 or 30%, it's still important to give yourself a shot, at better health. Because the truth is that when people get the flu, it's not a benign illness, but it often leads many senior citizens to get hospitalized. And we've had a number of infants and young children who have died from the flu. So it's important that we do everything we can to prevent, to protect ourselves and to protect our community. But lastly, I will say on the immunization front that one of the challenges that people face to getting immunizations is having health insurance coverage. For a family that doesn't have health insurance coverage, the cost of going to the doctor and getting an immunization can sometimes be prohibitive. And that's why it's important for people to get covered as well. We have an opportunity now through the marketplace, through the healthcare exchanges, for people to get insurance, often at very affordable rates. It turns out that 87% of the individuals who have secured coverage on the marketplace or on the exchanges have actually received some degree of financial assistance to do so. And in fact, when I was over in Richmond just a few days ago, I met a woman who has not been uninsured for 10 years. And she, has spent most of her time taking care of her autistic son and her mother and her sister and brother, all three of whom are actually in a nursing home. And she didn't have insurance though during this whole time, but recently was able to get coverage for the price of $3.50 a month with federal assistance. And so there is affordable coverage available to a lot of folks, but many of them don't know it. So February 15th is the deadline, though, for signing up for coverage through the exchanges. We want people to go to healthcare.gov and check it out and see if there are plans that make sense for them and their family, and see what financial help that may be available for them. I did hear from one of the community leaders here that they feel that public health is significantly underfunded in Missouri as well, in Missouri in particular. And so I know it's a real concern here. I have not heard any updates on a state level about what's being done from a funding perspective, but that's something I'm looking forward to continuing discussions with our community about here, because I do believe that public health funding is important. If we invest in prevention, it saves us more money down the line. And I'm not just talking about clinical prevention, I'm talking about community prevention. And this is an important point I want to make, is that when we think about prevention, people sometimes just think we're talking about getting mammograms and talking about immunizations. And those are important forms of prevention. Important forms, in fact, that are now free and available without copays once you have insurance coverage, under the Affordable Care Act. But prevention is also about what communities do and how they collaborate to make cities safer, to make cities more walkable, to make healthy foods available, and to make activity easier. It's about making healthy choices easier and more desirable. And investments that we make in community prevention are extremely important, and they save us a lot of disease and healthcare costs later down the line. So I'm very interested in how we can strengthen public health investment in Missouri and in states across the country, and I'm looking forward to working with this community on that issue.
It really helps to have somebody that's a convener and has such a public pulpit like he does. When you think back on prior Surgeons General, HIV, when you think about tobacco cessation, there's been almost nothing as big of an impact coming from the Surgeon General as those kind of things. He's got his own agendas, and I think they're well aligned with what we are believing is important for us here too.
He was really coming to talk to the community about what are the biggest issues that we faced in the public health arena, and what are some of the things that we've done that have been very innovative about trying to tackle some of those. And through his countrywide listening tour, really trying to figure that out for many communities and figure out through his office how can he start connecting communities to share best practices and use new technologies and new ways of communicating to really help all our communities with these very challenging issues.
I'd just like to say thank you. Thank you so much for that. housing authorities. Thank you.
Okay, thanks so much. Good to see you. Thanks for being here.